Charles Joseph Cote. I'm a pediatric anesthesiologist. I'm a professor of anesthesia and critical care medicine at the Massachusetts General Hospital and Harvard Medical School. The book has had a very nice history to it. It started off actually when I was a junior faculty at Mass General, and one of my colleagues had been approached to put together a pediatric book, and things were kind of mumbling along for a little bit, and then our chief of anesthesia asked me if I would take it on as a sub-editor and kind of honcho people to get all the chapters written. And so the first book was about, I think, 20 chapters long, maybe 250 pages at the most, all written by people within our department. And then the next edition came along about 5 years later, and we expanded it. More chapters, more authors from other institutions. Then the third edition, again, expanded again and started to take on more of an international flavor with international authors. And then the last edition, the fourth edition, which is the current one, we expanded to 120 authors from 6 continents, 52 chapters, added color for the first time, and a website that provided places for additional tables and figures and video clips, and also the ability to search for references that can be directly downloaded from PubMed. And so this has been an enormous improvement. The book is very well read around the world, actually, and so we're just delighted at the job the company did to develop such a wonderful product for us, because the first 3 editions were in black and white, and this last one was absolutely fantastic, because all the artwork was redone and all the photography was reshot. And so we're now in the process of beginning the 5th edition. We're going to probably keep it the same size or maybe a tiny bit smaller than the current edition, but it's going to be greatly expanded in terms of web content, with lots of video clips of ultrasound-guided regional anesthesia, ultrasound-guided insertion of vascular catheters, video clips of specific operations. So I think it's going to have much more content, and the fact that it's going to be able to be used on an e-reader, where somebody can just poke the X and have a video clip appear on the screen of their e-reader, that's going to be just absolutely awesome. So we're delighted with the company and the work they've put into it, and we hope that our readers continue to enjoy it. The greatest area of expansion is the use of ultrasound for placing specific nerve blocks in a much safer and more precise manner in children. And it's particularly valuable to us because we put the children to sleep first and then we put the block in, unlike in adults where they put them in when the patient's awake. And so some people would feel that the patient being awake is a safer process because they can tell you if you hit a nerve with the needle. We can't do that in children, and so having the ultrasound, I think, has greatly improved the assurance that we're going to minimize the potential for an injury to a nerve, and also, and more importantly, have a successful block for post-operative pain relief. Same thing is true for vascular access. So for inserting a central venous catheter, much more assured that you're not going to hit a vital structure. So that's a big plus. And then I think the other thing is the big controversy and concern in pediatric anesthesia now is the potential for neurotoxicity related to just about every drug we use to provide anesthesia to children. And so we have devoted a new chapter just to that topic, to what's known, what's not known, and where we need to go in the future. And I'm sure that we'll be posting articles of interest on the website as they come up to help our readers. I think the experience with Elsevier has been very positive, and in particular with this past edition, they really went to the whole 9 yards, I guess, to come up with very excellent artwork. So the artwork was very well done, and just the color setup in the book is very aesthetically pleasing. The other thing I want to say, though, is I want to compliment Elsevier for helping me and other anesthesia colleagues in third world situations. There are a number of times where I've asked Elsevier to donate books to countries that I know people are going to deliver care in less austere, I should say more austere conditions. And in particular, I have to say, when I called and asked Elsevier to restock the 2 anesthesia libraries in Haiti, they delivered big time. There were well over 200 pounds of books that were delivered and hand-carried to Haiti, some of which still haven't gotten there because they had reached their limit for the weight that the airline would allow them to take. But I have to say congratulations to Elsevier on that, and I hope they continue that. One of those requests when we come up with them.